2012, and there's going to be a lot of changes to your health care coming in 2012 this year. Joining us this morning is healthcare insurance broker Craig Gussin, here to explain what you can expect. And we always hear about these things happening every single year. There's changes in so many laws, but healthcare affects pretty much everybody.
It does.
And we got changes in the state, got changes nationally speaking as well. Let's start with the state here in California. What are some of the biggest changes we see this year for healthcare?
The biggest change that I see, first of all, is going to be in July, and that is that in July, effective July 1st, every plan in California has to include maternity coverage.
Which is surprising, because you would think most plans already carry maternity coverage, but they don't.
Group plans, almost all of them do. Individual, 5 years ago, 70% of them did. Now about 10% of them do. And the reason is because in most situations, especially with a woman, when she has a choice between buying maternity coverage plan or one without maternity coverage, and you know that the difference can be anywhere from $200 to $400 a month difference in premiums based on your age, they're going to go with the non-maternity coverage saying, I'll get it later when I plan on having a family.
Is it hard to upgrade, though, your insurance coverage later when you start thinking about having a child?
Depending on your health. If you're healthy, you can get it. If you're not, you can't. But again, January 1st, 2014, when health care reform goes into effect, all this would change. But for the moment, my big concern is, you know, a lot of people like you're a guy. You don't need maternity coverage.
But my wife does.
Your wife does.
Yeah.
So the question is, you know, I think what the legislature in Sacramento wanted to make sure is that everybody can afford to get coverage with maternity coverage. However, when I did some numbers and I looked at if you were 25, 35, or 45, the cost, you know, a 25-year-old, the difference between a maternity plan and a non-maternity was, you know, $269 a month. A 35 was $411 a month. And a 45-year-old, the difference in premium was, you know, about $250 a month. So big changes. And if they're going to add maternity coverage to every plan in California, especially individual, costs have to go up. I've heard costs may go up anywhere from 10% to maybe $10 a month up to $50 a month. And I'm thinking closer to $50 a month. Because anybody that had a baby knows that it costs anywhere from $10,000 to, if it's a premature baby, it could be $1 million.
Yeah, it can be, and a lot of people have seen that. And you bring up a good point about the cost of health care coverage. Will we see a change, generally speaking, about the cost of health care in the state of California going into 2012?
You know, in California, we have one of the lowest rates in the country for health insurance. Out of all the states, we are the 8th lowest rate. And California, if California was a country, we'd be the 8th largest country in the world.
Right.
So when you consider that we have the 8th lowest rates, New York, New Jersey, and Massachusetts have the highest rates in the country, you realize we're doing it right. And that is because we have 7 insurance companies in California, we have competition, pretty much everything they've done right. And so that's the good part of California. Our rates have nowhere to go, Tom, but up. When you look at New York, New Jersey, and Massachusetts, and the best example I can give you is I have a client who lives in New York. She is 59, has a $1,000 deductible plan, and is paying $1,859 a month for her plan.
Wow. In
San Diego, it would cost somewhere between $500 to $600 a month, depending on the plan.
Okay, well, that's the difference in California. What other laws, though, are going to be changing this year in the state and then across the country, too?
The other law, which is a California law, has to do with disability. If you're an employer with 5 or more employees, and your female employee goes on maternity leave, you have to keep her on your health insurance plan for up to 4 months. You have to continue to pay your portion of her health insurance. And the employee is supposed to be paying her portion of it. But again, if you're on maternity leave, you're not working. And if you're not working, in today's world, what ends up happening is they take the money out of your paycheck, and then so that the employer gets the money back. Well, if you're not working, you got to turn around, write a check to your employer, but then you're not working. How are you going to get the money from the employee to pay for their portion of it? And if you don't pay for your health insurance, can the employer cancel your plan? Nothing is said. They can't do it federally, but
it gets so confusing. And of course, a lot of people will be turning to people like you for advice on this. How can people get a hold of you, Craig Gussin?
The best way to contact us is our organization called the San Diego Association of Health Underwriters. Most brokers that write health insurance are going to belong to that organization. And if you deal with any broker who is part of our organization, they're going to know the education part and really know what's going on and all the changes going on locally and nationally and how to best fit your needs.
Okay. Thank you so much. Great insight. I know a lot of changes are afoot this year for 2012. And We appreciate your insight and for getting up so early on a holiday morning. We appreciate it. Craig Gussin, thank you so much for your time.